Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Treating fibroids can be easy and probably complicated depending on your approach to the condition. In most cases, the stigma attached to the condition forces many to seek non-medical ways of treatment, which sometimes can be very harmful. Sylvia Mutesi, who has suffered fibroids for more than 5 years now, admits she was lured to try herbal treatment.
Like for a year, that is 2017. On testing 2018, they told me they had increased now to 7.
Following the disappointment, she was advised to seek medical treatment.
Last year, one of the gynecologists I went to advised me that maybe I should do an operation to remove them because now there were 2 which had grown in size. Treatment I went for it is called laparoscopy.
Dr. Gonzaga Andabati, a fertility expert at Bethany Women's and Family Hospital, says there are many treatment options.
We have medications. These medications often are injectables. They can be taken once a month or every 3 months. But the other issue with the medication is that they give a temporary relief of the symptoms. And then after the medications are stopped, usually the fibroids will grow back. You can remove them usually through operations. This can be through open technique or through what we now know as keyhole surgery or the laparoscopy method, which is not commonly known by people, but it's available in the country, and I think it's now the one we should move towards. The other options of treatment for fibroids are what we call uterine artery embolization. Now, this is a new technique of treatment where you, through guidance of some special X-ray, you locate the blood supply to the fibroid and you block it. And this method is good. It helps you avoid surgery, but the problem is it's not appropriate where there are so many fibroids, because then you will have to look for the different blood vessels, which becomes a very difficult procedure. And then very recently there's a technique where you use a high frequency ultrasound. You direct that specific ultrasound into the fibroid, it melts the fibroid and the fibroid can dissolve off. But again, you can see this is only appropriate where the fibroid is like one piece or where it is smaller.
However, he emphasizes the importance of speaking with your doctor before any treatment can be given.
Because sometimes in these cases, if you do inadvertent treatment, unnecessary treatment, you can bring in more problems.
The various treatments also have their corresponding cost.
To 4 million really in the private arrangement for the open technique. It's a little bit higher for laparoscopy. I think it may cost somewhere between maybe 6 on average.
In October 2018, the National Women's and Neonatal Hospital was commissioned in Mulago to provide such specialized services at a subsidized fee to those who can't afford private facilities. However, 2 years down the road, most of the highly specialized services are unavailable due to a lack of medical specialists.
They have people they have booked even ahead like 1 year. But they don't have, this is a very highly specialized service that requires more staff, more trained nurses, which we are doing, but you know, to train a specialist like that, it takes a while. Eh? But we shall upscale as we continue increasing the number of staff in the hospital, but also more equipping.
Dr. Andabati hopes to upgrade his facility to a training school in the future.
For the field of fertility treatment and also keyhole surgery.
And the Ministry of Health has promised to support him and others like him for the benefit of expanding specialized services in the country.
So we are beginning with providing and developing a bill. This bill will go a long way to protect them, but also it will go a long way to link, to network all the people who are providing this service.
Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.